Well, good morning. Actually, it's nearly midday and it's Sunday the 8th of March. Now, yesterday I completely messed up the sound, so my apologies for that. And thank you for those people that kindly pointed that out. Now, things are moving rapidly with COVID-19, the coronavirus discovered in 2019. Now, basically, I think this is the worst contagion of my career. Now, I started as a first-year student nurse in 1975. 3 weeks after my 18th birthday. And the only thing I can compare this with really is the outbreak of HIV, AIDS in the early 80s. When I first started learning about that was remarkably concerning, and my concerns have been largely borne out with that, although it could have been even worse. We didn't know in the early days. But this is the worst thing, I would say, including the early AIDS outbreak, because COVID-19 is transmitted in social circumstances, whereas HIV is transmitted mostly sexually and via needle use, mostly, not exclusively. So basically, I think we're looking at the world's worst pandemic since the 1918-1919 pandemic. Now, this was caused by the H1N1 influenza virus. Now, we know this. If you go onto YouTube, you can watch some fascinating studies of scientists going to dig up bodies that were buried as a result of this influenza outbreak in 1918-19 that were buried in the permafrost. And they were able to do genetic analysis to show that this was indeed the virus. Now, that outbreak affected 27% of the world's population at the time. 500 million people were infected. It killed 200,000 people in my country. It killed 500 million people worldwide. Now, I'm not yet comparing this with that, but I am saying that this is the worst pandemic, in my view, or is going to pan out to be the worst pandemic, in my view, since that time. God willing, it won't be anything like as bad as that. So what we need is a wartime footing to fight this, because at the moment we're just dithering around the edges, really. I mean, you know, in the Western world especially, we need to go into a real wartime footing to fight this common enemy. And in terms of the science, we need a vaccine, and people are working on it flat out, but we really need a Manhattan Project or an Apollo Moon program to get that vaccine up and running. Now, I'm going to start off with a few numbers which I've been thinking about overnight. And these are the first numbers I want to mention. Now, well, that's the total number of confirmed cases globally, first of all, up there. Now, these numbers here, 80%, 15%, 5%, of the people that get infected, 80% get a mild illness. That's great. 15% are really quite poorly, but 5% are critical and need quite a lot of medical support to get them through this. So this 5% that's critical, I'm quite happy to define that as people that might not make it without medical support. Now, if we take, for example, 1 million people who are infected, 800,000 will get a mild illness, absolutely wonderful. But 150,000 are going to be quite ill. And 50,000 of those are going to need medical support to get through. Now, many countries in the world cannot supply medical support to that many people all at once if there's 1 million people infected. In fact, I can't think of any country in the world that can supply that much critical medical support to 50,000 people all at the same time. And this is going to increase the case fatality rate where healthcare provision is weaker. No question about that. This is going to increase case fatality in poorer areas with weaker healthcare systems. And that's if 1 million people are infected. Of course, it could be higher than that. I'm not going. You can imagine the numbers now. I've been mulling these numbers around in my mind for some time now, unsure whether to put them onto this video, but I decided to today. So these are the kind of figures that we could be looking at, and I'm especially concerned, as I've said, about poorer areas. This is why it's so important to contain and delay. because we need to reduce the peak. We don't want this epidemic to go straight up, lots of numbers all of a sudden, and then go down. We can't cope with all those people sick at the same time. We need to flatten this curve out so that the epidemic is longer and more, less people at the same time. Not longer, but we want less people to be infected at the same time. Global containment now needed. I'm going to look at some examples of where this has worked and where this is sadly lacking as we go through today. So they're the numbers that have been swirling around in my head, I'm afraid. Now, just a couple of things to mention. Other brands are available. I have no interest in any of these, I assure you. No financial interest at all. I'm taking one of these a day. 25 micrograms every day. That's what I'm doing. And that's because there's evidence. And I'm going to do this in detail, but there is evidence that people are often short of vitamin D. And there's evidence that vitamin D will reduce the likelihood of contracting viral and bacterial respiratory infections. Now, I do not know if vitamin D will reduce my likelihood of catching COVID-19. We don't know that yet. But there is data that shows that adequate amounts of vitamin D, and a lot of us are short of vitamin D, does reduce the probability of contracting viral and bacterial chest infections. And if you contract it, there's also emerging evidence that the infection may be less severe. So I'm taking one of those a day. Now note, these are not multivitamins. They're not multivitamins. It's only vitamin D. That's the only one I think I'm short of. Other than that, if you've got a good balanced diet, I don't think you need multivitamins. I don't think there's evidence to support that. Garlic is doing the rounds. There is no evidence I am aware of to support garlic as a preventative. Now, garlic's good for you. Eat it all you like. It's sometimes not very good for your social life, but eat it all you want. But in terms of protecting us against viral and bacterial illnesses, I don't know of any evidence for that. Moving on to the situation now in Italy. 1,200 new cases in the past 24 hours. Almost 6,000 cases now in Italy. And the death rate in Italy is frighteningly high. I almost wrote 4% down there. That's the figure I got, 3.96%, 233 deaths. Now, the health services in Italy are reasonably good. Well, they are good. I don't know why the death rate is so high in Italy. Is it because there's more elderly people in northern Italy? Well, there are a lot. That's true. So it could be partly population demographics. Is there comorbidity? Are the Italians still smoking quite a bit more than other countries? But we don't really know. But we do know that number is really a lot higher than we would like. In fact, well, we wouldn't like one at all, but it's certainly a bit higher. Now, the government in Italy, the Prime Minister has announced 16 people are to be restricted in Lombardy, Venice and Milan until April. Now, these areas are almost closed down now. There's police roadblocks around the area. If you've got a very good reason to travel, they might let you through. But basically, there's a big shutdown of 60 million people in these areas. Although, bizarrely, trains and aeroplanes still seem to be working. Although I don't think they're very full. Now, Italy has been quite proactive about this. This is another one of the sayings that we're shown in every video. I'm afraid you'll be bored of these. Italy has been reasonably proactive in this because at the moment my country is waiting to react. In my view, the United States has been waiting to react. It's no good. People can be cooking this virus, they can be incubating it for 7 to 14 days. We need proactivity. We need to be acting before the cases are confirmed. And to some extent, Italy did. Because they established red zones around these clusters on the 23rd of February. So remember what happens is, first of all, there's individual cases, few individual cases, then there's clusters, and then eventually there's community transmission. They're the three stages of this epidemic or any epidemic. Cases, individual cases, clusters, and then community transmission. So Italy were somewhat proactive there, but these red zones just shutting off areas of these regions in northern Italy didn't seem to be enough, so they've now shut them off altogether. So quite a dramatic move really for a European country. But I saw people on the news saying, oh, well, I live in the south of Italy, so I've just got an early train and rushed out down south before the cities, before the areas were closed off. Does that remind you of anywhere? People rushing out just before the deadline? It reminds me of Wuhan. Let's hope the comparison is a non-valid comparison. But people were dashing out because they were inconvenienced by this, and they didn't want to be inconvenienced and wanted to get to where they wanted to go, so they rushed out before the area was closed down. As happened in Wuhan. Public venues closed, football behind locked doors. What's the point in playing football behind locked doors? The whole point of football is to watch it. So quite why they're carrying on with that, I don't know. But religious ceremonies in North Italy all banned. No funerals, no weddings, no church services. So quite significant actions there, really. Moving on to China. Now there's been 44 new cases in Wuhan and no new community transmission cases in the rest of China. And that is nothing short of amazing. And I believe these figures. I know I get criticised for that, but the World Health Organization believe these figures. We have to go with data. So 44 cases in Wuhan. No new cases at all outside Hubei province. Now remember, before we were talking thousands of cases per day. This is quite remarkable. 44 new cases. No new cases outside Hubei province. And in the rest of China, 3 cases. But they were all backflow into China from other countries. So these 3 cases outside of Wuhan and Hubei province were people returning from abroad to China. 3 backflow cases. No new cases in the rest of China. Why is this? It's because China has closed down tens of millions of people. None pharmaceutical interventions, NPIs. So, we haven't got a drug yet. We haven't got a vaccine yet. But the Chinese have got their cases down from many thousands to 44 with non-pharmaceutical interventions. This can be done. China has been an experiment on a massive scale. Completely botched it up at the start. Disastrous start. Suppressing doctors. Suppressing information. Complete disaster at the start. Moving on to this absolutely brilliant response with the cooperation of the people. And this is what's so important. The people have to understand why this is important. We have to educate people why this is important. And when you do that, the Chinese population have complied with these non-pharmaceutical interventions. And it is working. We can defeat this virus, but we have to work together and we have to be really, really proactive. And at the moment, we're not being. In the Western world, we are not being sufficiently proactive. Therefore, we are not achieving the global containment that is needed. I won't show you those again, I promise. France, more cases. Germany, more cases. Interestingly, in Germany, no deaths as yet. Interesting. Now, the United States is getting its act together at long last on testing. So at the moment we have 433 cases in the United States, 19 deaths. Now, given that the United States is now putting out, we believe, hundreds of thousands of tests, unfortunately there's no doubt in my mind that we're going to see masses of new cases diagnosed in the United States. I don't think there's any question about that. Yeah, so 433 cases in the States. We're going to see many more. Now, we can't put precise numbers on this, but this is going to increase dramatically now with testing. I've got a few ideas where it's going. I'm not going to mention them publicly because I can't back it up with evidence. But now we have more testing in the United States. We are going to see many, many, many more cases confirmed positive. Washington State, still a bit of a cluster in Seattle. Well, is there a cluster in Seattle? Yes. Or is it because they're just doing testing there? Are there clusters in other places where they haven't tested for yet? not entirely clear yet. So Washington State, 100 cases with 16 deaths. 100 cases with 16 deaths. Now, many of these deaths were in this long-term sick care facility, underlining the importance of looking after vulnerable individuals. The Grand Princess is going to dock in Oakland. There's 21 positive cases on board and about 3,700 people on board. My concerns for that ship remain, because the Grand Princess is the sister ship of that other princess ship from Japan, the Diamond Princess, wasn't it? So that's a concern. I'm concerned that people could be getting infected on that ship. Now, Washington DC this time, as opposed to Washington State. I don't know if it's one case or several cases, but a case or more have been confirmed after political meetings where 15,000 people attended. So that's concerning. Where are the people infected at these political meetings? And there's one case in Washington DC without an epidemiological link, indicating that there could be some community transmission there. So that's a concern. And once the American testing program really gets going next week, we should have much more information about that. Concerning to see Latin America, South America being affected. First death in Argentina. If there's a death, it probably means it's actually been there for a week or two, actually. Because very often people deteriorate in the second week of this, or even the third week after infection. So slightly concerning there about Argentina. Iran is still a completely... The figures from Iran are still grossly underreported. We know there's terrible things happening in Iran. South Korea, okay, more new cases, but slightly less than yesterday, giving just over 7,000 cases formally diagnosed in South Korea, with 50 deaths. But encouraging to see that the death rate there is way lower than the death rate of almost 4% that we're seeing in Italy. So what's causing the difference in the death rate between South Korea and Italy isn't quite clear. But encouraging to see a much lower death rate in South Korea, despite the condition has been spreading there for a few weeks now. Bethlehem in the Palestinian territories, 16 cases. That area is still very closed off, with educational establishments shut down. Now, my country, the UK, 209 cases. You know, I was just watching the news this morning, and there was this rugby at Twickenham, people throwing a ball about the place. And I don't know, there was the 50,000 people watching it, something like that, you know, all packed in this stadium, you know, come on. And apparently some people have been saying if you're watching rugby or football in a pub, you're even more at risk than if you're in the grounds. So, and there's this Cheltenham Festival next week. You know, I conclude my country is not being proactive. I'm sure they'll cancel these things, these mass gathering events, once cases start popping up. But that's too late. I don't know. It's so frustrating. It just don't seem to. We don't seem to realise the need for this proactivity. People that are being symptomatic in my country, or even tested positive, are going into self-isolation and being monitored at home, which is the right thing to do as far as I can see. Australia, slow carrying on of cases there. Now, all these countries we've talked about here, Korea, the UK, Italy, we know these numbers are genuine now, so the data we're getting is definitely genuine. And it is being roughly consistent with the data we were getting out of China. So we are starting to get a better grip on the epidemiology of this virus now. This is massively concerning. 45 cases in Africa. Of course, there's going to be way more. They're just not doing much testing. And countries with poorer healthcare provision, the virus is going to spread, and the case fatality rate is potentially way, way higher. Bahrain, the 85 cases, the Grand Prix has been held behind closed doors. I suppose people will watch it on TV. But that's good in a sense, because watching it on TV, as long as it's not in a pub, is all right. So some degree of proactivity there from the authorities in Bahrain by making it a closed door Grand Prix. So basically the bottom line is we are starting to see things increase like I feared they would back in January actually. We are seeing an increase in global cases. My view is that many places are still not taking this with the seriousness it deserves. This is not just flu. This has got a much higher case fatality rate. It is a novel virus. We haven't been exposed to it before. And we need more proactivity than we have at the moment. Now, just to finish, this was a declaration made by me yesterday. Elbow bumps are friendly, welcoming, polite, correct, pragmatic, responsible, considerate and cool. There you go. That's an official declaration. You can tell people it's cool. Catch it, bin it, kill it. Good respiratory hygiene, because coughs and sneezes spread diseases. Personal hygiene cannot be, and the importance of personal hygiene cannot be overemphasised.